Hi, my name is Mackenzie Mack, and today I'm doing my presentation over Mycobacterium tuberculosis, which is a bacteria that is the cause of the virus tuberculosis. Today, I have with me my mom and my sister. The structure of the bacteria is that the cell wall is produced of acidic waxes. It is slow growing and non-mobile, meaning it does not move. Acidic fast and obligate aerobe. It is 2 to 4 micrometers long and has a slow gestation time of 15 to 20 hours. Tuberculosis gets its name from the formation of tubercles in the lungs, which is where the bacteria cells want to hide. The virulence is not distinctly classical, like most major causes of diseases caused by bacterial pathogens. The body tries to fight off the bacteria by producing exceeding amounts of copper and zinc, two beneficial metals to humans in small amounts, but can result in death when it is in exceeding amounts. The host response is an attack with metal poisoning and nutritional immunity that deprives the disease of metals of magnesium and iron, which is what the bacteria needs to produce more cells. How does a disease interfere with normal pathophysiology? The primary stage is that it sends off flu-like symptoms, which are told to rest and you'll be good. When it is left untreated, the cells will then spread and multiply, causing inflammation in the hilar lymph nodes. It increases in T helper cells, and the doctors will then produce a tuberculosis skin test by injecting a serum in your forearm. And after 2 days, if you have an induration, they will follow up with the chest x-ray and you will see lesions on the lungs, which is a sign of tuberculosis. The second phase is when you develop active tuberculosis. It can stay inactive for a long period of time. It starts with the cough, progressing into production of blood-tinged sputum. Diagnosis can take a long time. If it is left untreated, it can spread throughout the body and cause an infection of the spine, resulting in lifelong disabilities. Effects in the population. Mycobacterium tuberculosis is found worldwide. There is a higher chance of getting it in the sub-Saharan countries and countries from the former Soviet Union. Out of 1.7 million people, 1.3 million people have it in developing countries. In the U.S., those with AIDS have a 500 times greater chance of getting the disease. It is a severe problem in homeless people because they have a harder chance of seeking health care. The increasing number in the U.S. is due to immigrants and international travelers. Treatment is based on if it is latent or active, which means it is primary or mobile. The most common drugs are isoniazid, rifampicin, ethambutol, and prasomazid. If latent TB patients are found, they only need a specific type of drug. If they are active, the recommended treatment is multi-drug treatment. Patients must finish their drugs. If it is discontinued too soon or not taken properly, the infection will still be present and then it becomes resistant to the drug. The pathophysiology of the drug is that it causes nausea, vomiting, loss of appetite, jaundice, which is yellowing of the skin, dark urine, and fever. Treating active TB. You take multiple TB drugs for 6 to 9 months every day. Once the active TB is ruled out, the patient can be enrolled into the directly observed treatment short course, which is DOTS. Treated with one of the TB drugs for a period of 6 to 9 months is for the latent TB. You don't have to have multiple drugs to treat the primary. The new organization, DOTS, encourages patients to meet with the healthcare provider a few times weekly to ensure they are taking their medicines properly. Directly observed treatment short course is for patients with latent TB. It encourages patients to seek healthcare provider to ensure that they are taking their drugs correctly and the patients meet once a week to take 100 milligrams of isoniazid and 900 milligrams of rifampicin. Research shows that the combination therapy in this short period of time was more effective than taking the isoniazid alone and has a better compliance rate than the standard treatment. The pharmacology standpoint is the use of isoniazid is commonly used for a longer treatment of latent TB. Isoniazid is an antibacterial drug that has been used to treat TB since 1952. It can also be used to prevent and treat TB. The medicine must be taken daily for 9 months. The medicine is very toxic to the liver, so you must have regular liver function screenings if necessary. Preventing TB can be simple. You can improve the standards of your living, use basic sanitary procedures, check those at risk periodically with the basic skin test, and if you work in like hospitals or doctor's offices, you are giving N95 respirator masks. Sorry. Some interesting facts is that TB was a leading cause of death in 1650. Robert Koch used a new staining technique and identified the bacteria responsible for TB in 1885. By the 1900s, over 20% of the U.S. alone was affected by the age of 20. Antibiotics was produced, resulting in major decreases in the death rate by 1940. A vaccination called Bacillus Quamitigurin (BCG) reduces the severity of the pulmonary disease.